are here today as a department to support the PinkDrive outreach program to encourage more women to be aware of cancer issues, why they need to even download the app that is being launched today, the web-based cancer app that will assist them to detect or assess whether they have cancer or not at an early stage. And for us, that is much more of a proactive and preventative measure. But should it be detected, the earlier the better, so that there's early intervention in terms of treatment and we save more lives.
It's so great that there's this great innovation that can help women to do their own screening and self-examination, guiding them step by step, but also linking them to a provider who can give them further information and guide them on where to go. Great partnership between PinkDrive, our government, BD Pharmaceuticals to really come together and make sure that we're closing the care gap, which is the theme for World Cancer Commemoration Day this year.
If there's not a good working relationship between the City of Joburg, Gauteng Province, private initiatives, then we're not going to be able to close the gaps of care. So we must find a mechanism to sit together and to work on a plan, and then of course to get funding from central government through grants.
Now, unfortunately, recently, and this is an effect of COVID, of 2 years of COVID epidemics, and it's also an effect of the sudden closure of our sister institution, the Charlotte Makeke Hospital in town. Our numbers are now up to probably 500 to 600 per year. So this is an enormous strain on our ability to deliver. Certainly, PinkDrive is also a demonstration that you can deliver something what is not there otherwise. And if we're working for a joint goal and we coordinate what we are doing, we can actually go a long way. If we can't get rid of our patients, we better treat them.
Our approach is, I think, in synergy with what the PinkDrive is trying to achieve. So our contribution is long-term. Our relationship with PinkDrive and other similar entities is long-term. So we see a very positive future for the South African healthcare system. Lancet Laboratories will be part and parcel of closing the healthcare gap in South Africa.
Some of the reason why we as a company are involved in this, one, if you look at women's health and cancer, breast cancer, cervical cancer, prostate cancer, these are highly prevalent in the African society, actually twice that of what you see in high-income countries. Yet relative to diseases like malaria, TB, HIV, they don't receive the same level of attention. And that is really critical for us if you want to address key healthcare areas like non-communicable diseases like cancer in Africa. Patients need to be aware about what are their options. Patients need to be aware that there are treatment options available. And through this involvement with PinkDrive, it's really about reaching more patients, but also exposing patients to care pathways that lead to better outcomes. And for me, in terms of closing the gap, it's working with partners around the continuum of care, education, access, and treatment options. And that is how we see our key role in this initiative.
Campaigning for Cancer is a patient advocacy group that wants to make sure that patients get the right treatment at the right time with as few challenges as possible. And we've realized that that begins with identifying symptoms. And to this, we have created the My Cancer Guide app, which helps women screen and reminds them to screen on a monthly basis. It does self-screening and self-examination for both breast cancer and cervical cancer, and the app is free. So you can download it, register on the app, and you'll be able to keep a record of your self-examinations. It'll also educate the women to understand what are problems that they should be looking for and what not.
We're here to promote early warnings, early detection, and knowledge, because knowledge is power. So in partnership with PinkDrive, as they welcomed us to this Awareness Day, we'd like to appeal to South Africa to say, know the early warning signs. Every single person in South Africa can play their part, and by making sure that they have the knowledge on all cancers, on what are the signs and how to go about helping our people.
It's a very significant day, World Cancer Day. And as you can see, the numbers of people that have come out, not only for cancer screening, which is the most important screening here today, but also to understand what their health status is. Once again, without funding from corporate South Africa, philanthropic organizations, and the public, we would not be able to do what we do.